Well, welcome to the show, everyone. This is your host, Ken D. Foster, and today is a show that I think you'll really want to pay close attention to. You know, a lot of us over the last couple of years have had to see our healthcare providers. And for some of you, you've had a very good experience because you've taken 100% responsibility for your health and vitality, and you've gotten expert advice from a healthcare practitioner, and you've made your own choices. Others have not had that great experience. And your experience may be one where someone's told you to do something and, wow, it didn't work out well. Or they said, don't do something. And you knew in your heart of hearts that you really needed to do this, but you didn't know where to get that expert advice. And you didn't really know what you were dealing with the healthcare system. So today I have a very special guest. We're going to go take a little deep dive in the healthcare system. And I'll tell you why. It's not like you're not going to probably use the American healthcare system in the future, right? Wouldn't you like to really know the ins and outs and what's really going on in the system so that you can make definitive choices for yourself, no matter what's going on in your life or maybe for your family's life or maybe for a friend's life? It's an important show. I hope you'll stay tuned. My guest will be right with us, and we got to take a quick break, and then we'll come back with him. Well, welcome back to the show. Love those breaks, don't you? We have some really great sponsors. I'm so glad you're enjoying the sponsors as much as I am. I know a lot of you write in and not only tell me how great they are, but you're buying their products, so that's even better. My guest today is Dr. David Wilcox. And David, welcome to the show, first of all.
Thanks, Ken. I'm glad to be here today.
Yeah, it's an important show, an important message, as you heard me say in the prelogue. For those of you that don't know Dr. Wilcox, he holds a doctorate in prepared nursing, and he also holds a master's in health administration and is board certified in nursing in informatics. Okay. Dr. Wilcox has 28 years in the healthcare experience in which he has worked as a bedside nurse, hospital administrator, and in healthcare information technology, which has helped him to develop a unique perspective in the American health system, which is really what we're talking about today. How did you get started in all this? That's kind of what I want to go.
Sure. So, Ken, I have a multi-handicapped daughter, and when I had her when I was about 17 years old, and I would take her around to doctor's appointments and listen to what the doctor said. And I had a lot of respect for the clinicians. And so I was working in manufacturing. And when it came time to get laid off from manufacturing, I had some benefits to go to school. And I thought, you know what, I'm going to go to school and I'm going to become a nurse. And that's what I did. And then I left home early, so I didn't even have a high school diploma until I took my GED. And then I just kept going back to school. I would be afforded opportunities. I decided once I became an LPN, licensed practical nurse, I wanted to be a registered nurse. So I went right back to school for 2 years. Then I got a job in management, and they said I had to have my 4-year degree. So I went back, got my 4-year. Then my buddy said, hey, let's get our master's. So I did that. And then a few years back, I decided I wanted to get my doctorate degree. And I think of myself back then as this teenager, basically taking his daughter around from appointment to appointment. And I learned so much about healthcare since I'd been in it. I thought, what is the best way to teach people how to take care of themselves and how to actively move around the healthcare system when they get that insurance company denial, when the pharmacy is charging them too much money. And so I decided I was going to put pen to paper and I was going to write a book. And then I was going to put that in people's hands so that they can proactively know how to handle themselves in the healthcare system.
I love that. Well, we're going to talk about that book on this show quite a bit, actually. And, I just want to mention this. Like when you got into nursing, that was kind of unique for a man to be in the nursing field. And so I'll mention that, and I'd love to get your comments on. Hopefully it's becoming less a phenomena than it was, because I think men really deserve to be on the front lines, like with the nurses. And I'll just mention this to you. We have 6 nurses in our family. So we are immersed in frontline, wonderful, amazing individuals who are really help making a difference in the world. So I'm so glad you're part of that. So how is that going on right now? More and more men jumping into the field, or no?
Yeah, and back when I jumped into the field, I might add that I was also doing music part-time, and I had very long hair. And so I would have to tie my hair back for clinicals. And so one of the clinical instructors, who was very hard on everybody, she said to me, "You've got to get that up off your collar." And I said, "There's no way, Miss So-and-so, I'm going to take my hair and pin it up." And so I had to go to the director and, get a waiver so that I could have a ponytail. And it was,
my gosh. Well,
I
was looking in the background there. I'm gonna flash off screen here, but I see a guitar back there. Is that your guitar? Are you still playing?
Yeah, I play for myself now, but I was playing semi-professionally for years.
Oh, wow, that's awesome. Well, you and I have that in common. That's great. All right, let me just ask you this. So, how does a lay person like myself stay safe when they're assessing the healthcare system today? Especially when we're going to a hospital or a medical provider, and there's so much medical error and omissions and all this stuff going on that we read about all the time. How do I say stay safe?
So you do your research. That's the first thing. If you're not going to the hospital emergently, if you're going emergently, you can't do much research, right? But before you ever need the hospital system, you go on to sites like cms.gov and you look at the star ratings of the hospital. Those star ratings are actually the surveys that you get when you get discharged from the hospital. They're based on those scores. They're based on quality indicators, infection rates. They're based on a variety of metrics that show you them either being a 1-star, which is the lowest, or a 5-star, which is the highest. So immediately, if you've got 2 or 3 hospitals in your city, you want to go to the highest star rating hospital.
Do they do the same for doctors?
Yes, they do. But CMS, it's very hard to interpret it. But there is a healthgrades.com that you can look up any doctor, especially if you're going to go see a surgeon or somebody. I highly recommend you look that up. Because, sometimes doctors will give referrals because they're golfing buddies, but you don't know really what that guy does or doesn't do. I have a couple of stories in my book.
Well, let me do this. Well, I'm just going to put the book on the screen, but I can see we're going to take a quick break. So why don't we put the book on the screen when we come back? And I'm interested in those stories. Yeah. Okay, so we'll do that. We'll come back and share some of the stories.
UK Health Radio, the station that makes you feel good. UK Health Radio, the station that makes you feel good.
Well, welcome back, everybody. We're talking to Dr. David Wilcox. He's got a new book out. I think we'll put it on the screen, Avoid Being a Victim of the American Healthcare System. And where can they get this book, by the way, Dave?
You can get that up on Amazon. I also call it A Patient's Handbook for Survival. So it gives you all kinds of information on how to talk to a surgeon, what to look for, like we just talked about, star ratings at a hospital and things like that.
That's great. One of the challenges that I think a lot of people have is what you just said, talking to the surgeon, talking to the doctor. Maybe they feel inadequate as to what questions to ask, or they're feeling fearful about the outcome of the disease they may have. How do you help people overcome that? And what does it say in the book? Like, do you talk about this in the book?
I do. So doctors are very rushed individuals under our current fee-for-service system. They have to see a certain amount of patients. They're pressured sometimes to upcode and things like that. So it's very hard to get them for more than 5 minutes, 10 minutes at a time, tops. But you have to remember this. Your healthcare team are individuals that you hired to partner with you in your healthcare. You have to be an equal partner in your healthcare. And if somebody isn't listening to you, or somebody saying, hey, I'm the doctor here and I don't think that's what's going on, but you know your own body, then it's probably time to find somebody else. Back in the old days, that worked pretty well, but nowadays that's old school.
Yeah. I had a family member that was ill this year with a allergic reaction to a drug, was in the hospital for 5 days. And fortunately, my sister, who's been a nurse for 30 plus years, was there. And, I would come home and she would quiz me and say, did you ask the doctor why? Why are they doing this procedure? Why are they doing this? Why are this? How many other people have this disease? What is, there's a lot of questions. And at first I felt a little intimidated, but then I understood that that's what we need to do to take care of ourselves. Is that your experience?
Yes, definitely. And especially if you're in a hospital around medications, the clinicians are rushed. In fee-for-service system, they are rushed. They've got extra patients. They're running around like crazy. But when they give you medications, you want to ask, what is this medication for? Is this something that I normally take? And who ordered it? And because Tylenol's got 3 names, it's Tylenol if it's brand, it's acetaminophen if it's generic. And it's got another name for an IV version of it,
isn't it?
No, it's paracetamol.
Oh, okay.
It's the name, yeah.
Yeah.
Nobody will remember that.
Yeah, we won't, but they will remember Tylenol because of the brand. But that's another point. You've been on the front lines there for a long time, and a lot of these medications have a lot of side effects. How do and the doctors say, "Here's all the side effects. Now, do you want to take this or not?" How do you know what to take and what not to take? I mean, that's and who do you rely on there?
That's why you partner and you research. So here's a good example. If you come to a doctor with high cholesterol, the doctor's never going to say to you, why don't you just take meat and dairy out of your diet and then we'll measure your cholesterol again, right? Because I was at 240 and now I'm at 135. And what I did was I just removed meat and dairy out of my diet. So they don't really recommend those lifestyle changes that you can make. And I'm not saying don't take your statin drug. If doctor puts you on a statin drug, take it, especially if you're still eating meat and dairy. But it's that part of partnering in your care, realizing there are other alternatives that you don't, we're a pretty pill-based society. And the pharmaceutical companies love that. So if they can get you to buy a pill and that treats you for the rest of your life, you're generating income for the rest of your life to the pharmaceutical industry.
That's an important piece. It seems like, and I just speak for myself, but in my life, I have a chiropractor, I have a functional medical person, I have a naturopath, and I also have my own intuition, and I have my wife. I have a team, right?
Right.
I have a team around me that, if somebody's telling me one thing, I'm going to check it with a couple other people. Mm-hmm. What say you?
Yeah, that's exactly what you want. I mean, you are the perfect patient or healthcare consumer because you're not really a patient. You're more a healthcare consumer because you're educated enough to know that this is the kind of stuff you have to do. So case in point, I hurt my back. They wanted to jack me up on ibuprofen and painkillers and all that. And I went to a chiropractor. 3 sessions, it wasn't hurting anymore. So, people just don't realize that if you're eating right, if you're taking care of yourself, there's alternatives for you that you don't have to get hooked on pills.
There is alternatives. And, I had a ski accident. I tore up my medial meniscus. I had a bone fracture, MCL tear, ACL tear. And, I went to the orthopedic and they did an X-ray and then an MRI. And they said you had about a 30% of not having surgery, but it was getting better and better. I thought, well, there's nothing out of place, or maybe I should let me see. And I talked to some of my healers and, it ended up healing 100%. I was back on a bike in 2 weeks because of some of the alternative therapies that I was given. And, my other knee where I had surgery, it's still not right. So, it's one of those things you live and learn. But I think we're talking about looking at alternatives as to, what's going on there. Let me ask you another question. With regard to the healthcare system itself, Why isn't there much transparency in the system today?
Well, healthcare is complex, and that's not an accident, Ken. It's designed to be complex so that you don't know what's going on behind the scenes by the people who are vying for your healthcare dollars. So let's just think about healthcare as a business, because that's really, unfortunately, what it is. And some of us are trying to put the care back in healthcare, but as a business model. So it is 1/5 of our economy right now. About 20 cents of every dollar you spend is spent on healthcare. There's no incentive to fix it. The insurance companies, the pharmaceutical companies have it down. They're contributing lots of money to campaign contributions across both sides of the aisle to keep themselves unregulated, to keep the suspicion off. And then you have the hospital. So there was a price transparency law that went into effect in January of 2021, where hospitals are supposed to list out their common procedures in a consumer-friendly format on their webpage, which you might be able to find way at the bottom, but it won't be consumer-friendly. And so far, only 15% of the hospitals have complied with this. They issued their first fines last week to hospitals that didn't. But they're okay with being fined because they're making money. And, they don't want you to know that if you're going to get total knee surgery at their hospital, like in my area, I researched it, it cost me about $12,000 if I was paying out of pocket. If I went to an ambulatory surgical center, I would pay $8,000. And the ambulatory surgical center has better outcomes than my local hospital does. So they don't want you to do that kind of thing. I mean, you don't buy a car without research. You don't buy a house without research. I mean, so why would we buy healthcare without research?
We wouldn't, but I think the consumer doesn't even realize we have a choice, quite frankly. And I think that's what this is the message today. There are choices here, and we have to research and find out what those choices are. I love that we started out. There's a rating system for hospitals. I think that's number one. People need to know that. And in fact, why don't you give that where they can find that one more time? Because I think that's important.
I'll tell you where you can find it in one click, because some of the stuff is hard to decipher. Yeah. If you go to drdavidhelps.com and sign up for my newsletter, I will give you a healthcare resource guide that includes everything we're talking about today. One click away, you can get right into the CMS site and you can find it. You can go to Health Grades, check out your doc. You can go to GoodRx from it. And there's also a pricing tool in there where you can find out what your labs cost within your area. And I did that resource guide because most people, they don't have the knowledge that I have around finding this stuff. So it's just one click away, drdavidhelps.com.
Okay, Dr. David has spelled the last name?
Helps, Helps.
Helps.com, drdavidhelps.com. Okay, that's awesome. Hey, why in the world in our country do drugs cost, 10 times more than Mexico, let's say?
Yeah.
Why is that?
And you're right, about 10 times. They say it's research and development, but the pharmaceutical industry gets a lot of money from your taxes for research and development. And that's been going on since like 1944, I believe, is when they started doing that.
Now, how much sense does this make? These industries are making billions of dollars, and yet they're being subsidized by the government, is what I'm hearing you say.
Yeah, the research is. Yes, definitely.
Research.
Yeah, the research pieces of it.
Is that through the colleges? Is that where's that money funneling into, the research and development?
Into the pharmaceutical research firms, so that they can create new drugs. And they say that's why we have to pay more money, because we're paying the research. The other piece of it is, there's also a little known law.
But wait a second, that makes no sense. So my tax dollars is going in to fund the research, so that I should get a discount on my drugs. It should be more. If I'm funding the research, I should probably own some of that research.
You're exactly. But in the American healthcare system for Medicare, we have a law in effect that basically does not allow Medicare to negotiate drug prices. The Department of Health and Human Secretary cannot negotiate drug prices for Medicare. That's insane, right? You can for Medicaid. You can do it for Medicaid, but for Medicare, you can't do it. It costs Americans $11 billion a year, it's estimated.
$11 billion a year. How do we change that? I mean, I want you to answer that right after the break. We're coming right back. Well, welcome back, everybody. We're talking with Dr. David Wilcox. We're talking about the healthcare system and what you can do to protect yourself and your family and really know and give yourself a lot more choice. I think that's what we're talking about. All right. So is there anything we can do as consumers to maybe help overcome the high price of drugs and what's going on out there? I mean, is there anything we can do? How do we vote?
Sure. So there's several things you can do. I mean, I don't hold much hope for the political system ever doing that for us unless they're really pushed. Like we're seeing some legislation around insulin, right? Because people are dying, they're rationing their insulin. But you, as a healthcare consumer, you can go to sites like GoodRx, drop in your zip code and see what your prescription costs. Many times it's less than what you're paying with insurance and a copay. Mark Cuban started an online pharmacy that deals with generic drugs. And this is all in that resource guide at drdavidhelps.com that I'll give you free. You can click in there and find generic drugs at much less of a cost. So it's interesting because the way the pharmacy business is set up, there are these pharmacy benefit managers that nobody ever can see or talk to, but they make medical decisions. You ever get that notice that you're not going to get that drug because your doctor has to fill out the pre-authorization form, and he fills it out and then they come back with another pre-authorization form? They're doing that because they don't want to pay for your medication. But they're making medical decisions. They're getting in the way of the doctor and the patient's relationship and making these decisions. And people are getting hurt because of these decisions they're making. When they first started out in the 80s, it was a decent organization, but then they slowly got bought up by the pharmaceutical companies. And so the pharmacy benefit manager who looked out for your best interest in the 80s now looks out for the insurance company and the pharmacy's best interest, as well as their own.
Does this tie into why our insurance costs are so high too? Is this all interrelated somehow?
Yes, it's definitely interrelated because insurance is a business. When you think about the business aspect of insurance, they sit between you, because they're the payer, so they have a lot of power, and the hospital and the doctor and the healthcare consumer, and they make those decisions. They'll deal with a group of doctors and say they're in network. Very hard for you to find out who's in network, right? And if you go to somebody out of network, you'll discover it really quickly because you'll pay a higher bill. So there's all this stuff going on behind the scenes that people don't know about. And that's what drives up the cost of healthcare, especially drives up the cost of insurance.
Interesting. Well, when I was asking about voting, I was talking about voting with our own choices of what we're buying, what we're putting in our body, and who we're buying it from. I was thinking more than the political side.
Yeah. Well, a lot of it gets stalled in the political arena. So, I mean, that law, with Medicare where they can't even negotiate the price, I mean, that's crazy. But that got rammed through in the Bush administration, and it hasn't been repealed since. So, they're looking out. The
challenge is who's going to repeal it? Because if you're taking money from the pharmaceutical industry or the insurance industry and you're a politician, you're gonna go out and form a bill to repeal that, and you're gonna cut off your funding. This is a challenge.
Yeah, and that's why the American healthcare system is 17th among industrialized nations, the 17 industrialized nations, for healthcare outcomes, and why we pay 19.7% of our GDP into healthcare and get lousy return on investment.
So it's we had monopoly laws back in the 20s and 30s. Whatever happened to those laws? I'm just curious. I mean, it seems like we have a monopolistic system here.
Yeah,
it's even worse than a monopoly because there's so many hands in it.
Exactly. So the example I gave you about Mark Cuban's pharmacy. So he cut out those pharmacy benefit managers, won't deal with them, won't talk to them. He goes directly to the pharmaceutical company and says, I'm going to buy X amount of stuff and I want a deal. And then he passes the savings on to people who go to his online pharmacy. Now, the pharmaceutical industry is taking note of this, right? Because now we've got GoodRx out there that they work with the pharmacy benefit managers, but this is the first time somebody set something up and said, no, we're not interested in making money off off of people. We want to do the right thing. And so they're very nervous about what this guy's doing. And rightfully so. They've been jacking the price up, like you said, 10 times. You can get an EpiPen for an allergic reaction, an epinephrine pen that people need for $67 in England, and it costs you here $680 for a package of 2.
Oh my gosh, that's crazy. All right, well, listen, I got to close out this segment. I want to thank you so much for being here with us, and again, for writing this amazing book. I want to put it up on the screen one more time. How to Avoid Being a Victim of the American Healthcare System. I hope you'll check it out on Amazon and get that book. Dr. David Wilcox, appreciate you being on this segment.
UK Health Radio, the station that makes you feel good. UK Health Radio, the station that makes you feel good.
Welcome back, everybody, to this next segment with Ken D. Foster and Dr. David Wilcox. All right. This has been an amazing, I've done several shows today. I'm really enjoying this show. This is this is so informative for everybody here. So,
yeah, so am I. Thank you.
Let's take a little spin here. Let's go into technology, because, we've heard a lot about tracking's coming, and what does technology look like in the healthcare industry in the future here, and then maybe even in the near future?
Well, it's interesting because the pandemic really accelerated technology in the healthcare industry. So remember what we talked about in the last segment, fee for service, right? That's when you show up sick, you make the money. We're using technology in the healthcare segment to keep people out of the hospital. Yes, I said that, to keep them out of the hospital. And the reason why we're doing that is another model that only 25% of Americans know about. It's called value-based care, and it's administered by accountable care organizations. This is very important for people to hear, because if your doctor's not part of an accountable care organization, you want to flip the script and get one. Because what happens there is the insurance company pays them a certain amount of money for Ken's Healthcare and says, okay, so we're going to give you X amount a year. And if you keep Ken healthy and out of the hospital, you get to keep the profit. So now all of a sudden, the medical community has skin in the game. They're not incentivized to see patient after patient after patient. They're incentivized to sit down with you, Ken, and say, so tell me about your home life. I noticed that you're in such and such a zip code. Do you have enough to eat? How do you get around? What's your transportation issues? Is there violence in the house? They want to know everything about you. In fact, sometimes they even make home visits, right? Just to see your environment, because the actual medical piece of it is only 20%. The other 80% is where you live, what zip code you live in. But they're incentivized. These guys keep you happy, they keep you healthy, and they get to keep the difference.
Wow, I love that. Well, sounds like life coaching may have a crossover here with the working with the accountable care organizations. So, is this when you say accountable care organizations? I know it's been proposed out there where one doctor might just get rid of all insurance and charges his patients, $1,000 a year, and he'll take care of their needs. Right? Is this what we're
No, that's called concierge care.
Concierge care, okay.
And that's available for people who have money, right? But This is an accountable care organization is a fancy word for a bunch of doctors that get together. They try to keep you in network. So your general practitioner says, hey, I need you to go see this cardiologist. He's going to send you to one of the guys in network. It's because they're going to share in keeping you healthy, right? They're going to text you, hey, it's time for your flu shot, or hey, it's time again for your colonoscopy, because they want you healthy. But it's just a bunch of docs, home care sometimes is involved, registered dietitians, physical therapy, occupational therapy, all of those all together into one area that share the profit, and they take care of your care. They get to know you. They know you as a person. They're not incentivized to put you on that conveyor belt and get you seen, and then move to the next person and move to the next person. It's
Wow.
really
Okay.
it's a much better model of care.
That sounds like a phenomenal way to do it. You know, I touched on people being tracked, their healthcare, and the technology that was coming in that could tell us if you've been exposed to a disease or any of that. Is that happening out there? Is that
Yes.
is there anything we should be worried about, or is that something we should embrace? What do you think?
It's something I feel it's something you should embrace. So there's a model called Hospital at Home where they can take care of you at home. They can hook you up to sensors. A value-based care model, if you had congestive heart failure, usually what happens with somebody who has congestive heart failure is they start to gain weight, they start to feel bad, and they go into a full-blown crisis, end up in the emergency room, costing a lot of money to themselves and their payers and making money for the hospital. In value-based care, they're going to send you home with a wireless blood pressure cuff. They're going to send you home with a pulse oximeter to measure your oxygen levels. They're going to send you home with a wireless scale. They're going to hook up your Fitbit or your Apple Watch, and then they're going to watch you. And then if they see, Ken's not walking as much as he normally does, and his oxygen sats are coming down a little bit, and it looks like he gained 4 pounds over the last couple of days, you're going to get a call, a text, something that says, hey, we'd like you to get on your computer and see the doc at 2:00 today. Can you do that? Sure. So you get on and the doc says, hey, we noticed there's been some changes. We're going to increase your Lasix, which is a diuretic, from 10 milligrams to 20 milligrams and see how you do. They get you before you go into that full-blown crisis, right? Because they're charged with keeping you healthy. And that's a great model of care because the patient feels better. They're not in a germy environment in a hospital. They're not coming in every 90 days and full-blown CHF crisis. So it works very, very well.
That's wonderful. I'm just sitting here brainstorming in my mind thinking, is there right now in healthcare system where maybe there's a group of doctors that come together for a second opinion, right? It's like my healthcare provider says this, and I'm like, well, I don't want to go through the formal process of getting a second opinion, and fight the insurance company. I just want a second opinion. Is there an organization maybe formed yet called Second Opinion Medical Associates or
not that I know of?
Okay. Well, maybe we need.
But you do get second opinions. You've got medical people that surround you. That you told me about.
Yeah, but yeah. I don't think everybody does it like I do.
But that's a good point. So if you have a nurse in your network, access a nurse. We got into healthcare because we want to help people, right? And we know the system. I talk a little bit in my book about a lady that was talking about getting a procedure done by a doctor who was not the best and did not have the best outcomes. Yeah. And I'm sitting there thinking, I need to say something to her. So I did. And I said, I can't tell you who I am, but I work at the hospital, but you don't want this doctor to do that. And so she said, thank you. And when I saw her at the hospital, she was under the care of another physician, which had better outcomes. Yeah. But I couldn't have done that if I was prepping her for surgery, right? Because the hospital would have fired me. That's right. Yeah.
Well, I think that's really, it's profound advice. Actually, I think if you listen to this, you're my audience. Make friends with the nurse, right? Have a nurse, have a nurse that you not only their friend, you support them too in the best way you can, right?
Yep, so exactly.
I think this is really important piece. Where's healthcare going? Where are we going in the next iteration of healthcare? I got to take a quick break. Hey, welcome back, everybody. This is your host, Ken D. Foster. We're talking with Dr. David Wilcox today. And the question I proposed before the break was, where's healthcare going? Where are we going with all of this? It's going to get better. It's going to get worse. What do you think here? Is it going to get worse before it gets better, or where are we with this?
I think a couple of things. So first, yes, it's going to get worse before it gets better under fee for service. Like I alluded to, only 25% of Americans have ever heard of value-based care or have any understanding of how it works. But you remember the community doctor way back in the day, probably our grandparents, right? The community doctor came out to the house. He got a good look around at what people were eating, how they were living, treated them holistically, and then left and went to the next house. So we're getting back to that kind of a model with value-based care, but without the clinicians having to have skin in the game, it's never going to happen. So that's a good move for us. I don't think this country will ever go to like a Medicare for all. Medicare only pays 80%, right? There's a gap in there, and you've got to have gap insurance to pay the other 20%. And so their hospitals would be folding up left and right, at community hospitals especially, if we did it under our current system where we were only paying 80%. So I think value-based care is something that Americans need to learn more about, and I think that they'll have better outcomes under value-based care.
So I have a question around that. If you have a value-based care system that you could connect with, and you already have Medicare, is there any benefit to let's say a Medicare plus you have what they call it? We have the supplemental thing.
Yeah, gap insurance.
Gap insurance, yeah.
Yeah.
What if you already have that? Is there any advantage in finding a value-based system?
Yes, there is, because they're going to keep you healthy, and so that's that big advantage. And the government would prefer that you did that anyway because it lowers the costs.
Yeah. Okay. All right. Any other thoughts around where we're going with the future here?
I think that unless Americans start to do their own education, proactively educate themselves, they become, and you'll see in my book, there's people that got really hurt in the healthcare system. I just read about one the other day. The insurance company denied her a CT scan. She had some pain in her leg, and so they said she had to do 6 weeks of PT, and then they denied it again. 38 days later, they let her get it, and she had a huge sarcoma, a cancerous growth, where they had to amputate her leg, her foot, and half of her pelvis. And the doctor said if they were able to get to that prior to, then she would have just gotten treated with chemo and she would have been fine. So people are getting hurt because they're not doing their education. Another thing of these Medicare Advantage programs that are all tied to insurance companies. Insurance companies have CEOs that have to make incredibly big salaries. They're not in it to take care of you. You're a number to them. So when you get the chance to go on Medicare, just go on Medicare. The government doesn't make any profit off of you. They're never going to get in the way of you and your doctor, ever. They're never going to come back and say you can't have that CT test. If the doctor's writing CT tests for everybody he sees, they're going to investigate him, but they're not going to get in your care. They're not going to get in the middle of it.
That's good.
Yeah.
All right. Final thoughts. We got just a couple minutes to wrap up here. You kind of got the microphone here to the world, Dr. Wilcox. What do you want to share with people right now? Kind of summing things up here.
Be safe. Whatever you do, get yourself proactively educated and be safe. If you go to drdavidhelps.com, pick up my resource guide. It's absolutely free. I put it together so that people would have the resources. But educate yourself on the healthcare system. Make a medication list. Carry it with you. Make sure you give it to every doctor that you see, because you can't depend on the fact that they're talking to each other, especially if you're going for surgery.
I really like that. And so Dr. David Helps, HELPS.com. That is not his name. That is his website, Dr. David Helps. So Dr. David Helps. And, of course, it's Dr. David Wilcox. I just wanted to clarify that for my audience. And the book we'll put on the screen one last time, How to Avoid Being a Victim of American Healthcare System. You can get it on Amazon, probably where any other amazing books are sold. So I hope you'll check that out. Dr. David, thank you for being on this show. This is awesome.
Thank you, Ken.
I'm going to pass this show on to a whole bunch of people because they need to hear this. And, I'd love to have you back in a few months to maybe go over what's coming up, now. So
yeah, definitely. I'd love to come back. Enjoyed our conversation, and people stay safe out there.
Thank you. Thank you for being here. All right. So thank you so much for joining us today. And what did you learn today? I hope you learned what I learned. We learned about value-based care. We learned about accountable care organizations. We learned about taking full responsibility for all the medical decisions that you're making. We also learned about putting some different people on your team. Not when you're in crisis. Now, make a friend with a nurse. Make a friend with individuals that can help you make an informed choice when the time comes. It's good advice. I hope you'll follow that, because if you will, then what's going to happen? You're going to live a richer life. You're going to live a life with more joy and more ease and more grace. And it's always good to prepare, isn't it? It's good to be prepared. So I hope you'll tune into this. I hope you'll pass this show on to a whole bunch of people, because as Dr. David Wilcox just said, 25% of the people know about value-based care systems. I personally think it's a lot less than that. So let people know that that's out there, and let them know that they can join these systems. And you can ask your provider if they're part of this. The other thing we learned is that you can find out if your hospitals and or doctors, how they're rated. Wow, that's pretty cool. All right. So from my heart to yours, I hope you'll continue to watch this show. Let other people know about this show. Let your family and friends know about this show, and continue to look for and seek and see the unseeable and know the unknowable and do the impossible.